More women are dying in childbirth as a result. Heidi Jo Castro reports.
For years, this was the moment Shantae Harrell waited for. In December, at age 40, the longtime nurse finally became a mother. But baby Miguel's entrance into the world was fraught with complications.
Her heart stopped. So the doctors rushed in to resuscitate her. So they had her crunched up with her legs up in the air for about 5 to 6 hours. It was a lot of blood.
Her sister Serena says Shantae received a blood transfusion 2 days after the delivery, and hours later was told she could leave. But Serena was worried. Home was more than an hour away, and what if her sister took a turn for the worse?
She still couldn't lift her head up, and I was like, please don't let them discharge you.
Nevertheless, mother and son went home on Christmas Day, spending precious time together until New Year's Eve. Just hours after this video was taken, Shantae collapsed. Her family says a blood clot had formed in her lung. Pulmonary embolism is a leading cause of maternal deaths, and in the U.S., nearly 33 mothers die per 100,000 live births, the highest of all industrialized nations. Shantae Harrell joined that statistic on New Year's Day.
And I touched her, she was still warm and things, but by the time they got her to the hospital, they didn't know that she was dead. They said they did try.
Shantae's family believes she'd still be alive if maternity care had been closer to home. But the local hospital in Martinsville, Virginia, shuttered its maternity ward a year ago, a trend among rural hospitals in the U.S.
I think I've delivered about 1,500 babies.
Dr. Makunda Abdul Mbake was the last obstetrician in Martinsville.
When we close labor and delivery units, moms die. It's known. It's not rocket science. It's a definite known, phenomena.
And according to the Centers for Disease Control and Prevention, Black women in the U.S. are 3 times more likely to die from a pregnancy-related cause than white women.
As an African-American woman in the United States, health care and prenatal care of women dying from childbirth is exponential. But I never thought it would happen to me or my family in this action, like in this moment.
Miguel is now a happy 5-month-old raised by his aunt.
Papa, I love you.
My sister left us a gift. I want him to know how strong she was, how much she loved him, and how much she fought to have him.
Look at Mama.
She says she'll always teach him about the mom he had for 9 days. Heidi Jo Castro, Al Jazeera, Martinsville, Virginia.
Joining us live from Oakland, California, is Carmen Green. She's Vice President of Research and Strategy at the Collaborative. That's an organization focused on maternal and infant health. You know, for those of us watching from outside the U.S., you're going to have to help us understand why women are dying in childbirth in the world's richest country.
Absolutely. Thank you for having me.
So that was actually my first question. Why is this going on in a country that should have the resources to take care of people's most basic needs?
Hi, Mr. Veneer. Just a bit about the U.S. healthcare system. Medicaid is a social health insurance program. It is public and it's for most of the population who are low income and who cannot afford the private health insurance that is, of course, of higher quality. So with Medicaid, providers are reimbursed at a reasonable rate. They're not paid exorbitant amounts like the ones that were for private health care insurance. So it ties in so much to the provider pipeline. So for example, those doctors, OBGYNs, gynecologists, nurse midwives who come out of their training in the US, they're incentivized to go straight to metropolitan areas, to those large hospitals. And many of those don't even accept Medicaid. So the talent and the providers are moving directly away from the communities that need them most. It's about how in our US healthcare system, it values the dollar and incentivize high salaries over purpose and impact for birth outcomes.
So you were explaining to us that health practitioners are financially incentivized to actually not provide their services to low-income populations.
That's exactly what I'm saying. That is a large reason why lots of those obstetric wards in rural hospitals are being closed down. Those are where everyone comes to have their babies, and now they're considered a maternity care desert. Moms are having to drive upwards of an hour away to access the care that they need.
So a lot of these so-called deserts, right, medical deserts, happen to be in Republican counties. Do you feel that politics are a factor here?
Politics are a major factor here. A third of counties are rural, and many of the population, much of the population that lives there, rely on Medicaid. Those dollars are specifically allocated at the state legislative level, and we can advocate for them even more at the federal level, but this is a political swing issue.
And clearly, race is also a factor. Our reporter there was just saying that minorities and black women in particular are overrepresented in the childbirth deaths.
Absolutely. Black women are overrepresented. And because the population and the demographics in the U.S. are changing rapidly right now, migrant moms are at risk. Indigenous moms are at risk. Structural racism has a major part of the story.
Carmen Green, thank you so much for joining us today.
Thank you.
In the latest protests over police violence in the U.S., people are demanding justice.